In terms of my approach to patient care, some of the biggest challenges I think patients face when meeting a surgeon is just fear. I try to make sure that people are at ease and tell them most of the time, most people with shoulder problems don't ever need surgery. And so, and in fact, even if they do need shoulder surgery, the choice is entirely in their hands. And so we often work together to come up with a treatment plan. So I think the thing that sets me apart as an orthopedic surgeon is that I'm a shoulder specialist. That's all I do. And so day in and day out, from the first patient to the last patient, all I'm seeing are shoulder patients. And my specialty and my fellowship training or additional training I did was entirely in minimally invasive shoulder surgery. Some of the new things that we're seeing in orthopedic today is related to technology. We are now able to offer basically minimally invasive approaches to just about any problems that you may see in the shoulder. Most of the procedures that we do now are outpatient. And so you come and leave the same day. Typically, most of the procedures take less than an hour to do. Most people with shoulder problems have a difficult time sleeping, and that's why it's the #1 reason that people see me. So when we start to work together, that's something that we work on. And by finding a solution for them to get back to sleeping well again without waking up, that provides a lot of joy for me and a lot of satisfaction.
My approach to patient care is trying to take care of each patient like they are a family member. What I believe is really important, which is critical, is listening to the patient, truly understanding their problem and concerns. It's amazing how important the joints are, and it brings me great pleasure to try to help restore joint function, and this then allows patients to resume their normal function.
Everything has turned out absolutely fabulous. Since my first total knee, which was 8 years ago, I've done 3 half marathons, I've done a triathlon, and I do the Columbia Tower stair climb every year. So it's worked out well.
Amazingly, now joint replacement surgery that used to require patients to stay in the hospital for a week are now being done on an outpatient basis.
The last thing I just had done was my right total knee replacement. And it was just preventing me from doing the things I enjoy. I could do things, but I was in pain.
Patricia, let's see you walk now after your knee replacement. Patricia's about 2 hours out from her knee replacement. She's going home today. Great. She's doing fabulous now, coming back from her knee replacement, 2 hours out from surgery.
My favorite part of what I do is helping patients get back to their normal function.
As far as what sets me apart from other physicians, I've tried to talk to patients and understand what their goals are. They fill out many forms and intake questionnaires, but within the first 30 seconds of meeting them and making eye contact with them and asking them what's going on, I feel you learn a great deal about that person, more than all those forms combined. One of the most exciting advances in orthopedics over the past 5-10 years is focusing on patient-reported outcomes. How do the patients say they're doing afterwards, and measuring that. Along with that, we use the least invasive techniques possible to accomplish that goal. If the least invasive technique is an injection or physical therapy or a cast for a fracture, that's what we use. If it's a minimally invasive spinal decompression or microdiscectomy, then that's what we'll use too. So we try to tailor the treatment for the patient and then ask the patient afterwards how they're doing. It really brings the whole patient care and my experience as a doctor full circle. To be able to meet someone, see they're in distress, see what their problem is, and then come up with a plan and then see them back and make sure it's working well for them. Because then if they walk out of the office and they have a smile on their face and they're doing things with their family again, then you know that, that you did a good job.
My approach to patient care is to treat the patients as individuals and to try to form a partnership with the patients. The first goal is to listen to the patient, understand where they're coming from, what their goals are as far as getting back to their activities, sports, and daily life, and then to come up with the best treatment plan that we can for them going forward. There have been many advances in orthopedics over the last several years. We do things in a much more minimally invasive way than we did before. So with smaller incisions, a lot of knee and shoulder surgery we can do arthroscopically or with using a small camera to do a large portion of the procedure. So the recovery is much faster than it used to be. I, like many orthopedic surgeons, was an athlete and had injuries, and through that process recognized the relative immediate impact that an orthopedic surgeon can have on someone's life. The most gratifying part of my job is when somebody comes in with an injury and we can make them better and get them back feeling as good as they were before.
Patients really want to be with a physician that they can trust, and that trust tends to come with communication, good explanation, and clarity, and so that they feel that that physician is really there to care for their needs.
With Dr. Angelo, my experience was a dialogue with somebody that started by just understanding me. And it was a series of questions to just get a better understanding of what had happened, what my goals were.
With surgical procedures, they are becoming more and more minimally invasive, and what that means is that tissues are handled very carefully, smaller incisions are made, less violation of muscle, ligament, tendon tissue, and so the healing process is not near as extensive as if a large incision perhaps were made to accomplish the same surgical procedure.
What I wanted to get out of the surgical experience to provide me the solution, both short-term and long-term, to get me back to my goal, which is skiing and returning to that same mountain and conquer the slope that took my ACL last year.
And to see those patients come back after regaining that health, that ability, that mobility to get back to the active lifestyle that they chose is a very, very rewarding experience.
Most of our pain that we treat is spine-related, either chronic neck or low back pain, but we also treat a variety of other chronic pain situations. Chronic pain affects almost every aspect of a patient's life. We're often asked about the role of technology in treating chronic pain. We're very fortunate that we live in an age where technology is extremely helpful. We have devices now that are available that weren't available even 5 or 10 years ago. The practice of pain medicine involves applying that technology in a strategic fashion. No two pain patients are the same, so you really need a wide array of tools, so to speak, to address those pain problems. The role of implantable devices has been a huge change in the last 10 to 15 years. Implantable devices are used in very severe cases of chronic pain. Spinal cord stimulation, for example, is used for patients that may have chronic pain after back surgery where they have nerve damage. That has been a lifesaver for many of our patients. But again, each patient is different. That may not work for one patient where it will work for the next patient. We have found that a team approach is really the best approach. We use our providers here as a team. Often we'll have a second set of eyes. I may see the patient on one visit, and maybe two of us will see the patient on the next visit. We also use our consulting physicians on a regular basis. We have a strong relationship in the community with a number of consultants, from neurologists to neurosurgeons to pain psychologists, as well as a number of others. A very important member of that team, however, is the patient. The patient is the expert in their own pain. We try to provide our expertise and our technology in a non-threatening environment where we can maximize the outcomes. Important to that is having a treatment plan and to be able to execute that plan with measurable goals. We treat the patients as people first, as patients second, but also realize that they're a family member, a spouse, a son or a daughter. And we feel that's extremely important in addressing their pain problem. We've had many patients over the years tell us that for the first time they felt they came to a clinic that really cared about them personally. And that's actually what motivates us. It is our goal to see chronic pain patients take control of their lives.